today I'm here with Marty Kestin, the creator of the Insomma Bodyworks technique, and in this video we'll be talking about practical ways to release trigger points and how that applies to Pilates practice and just general techniques that anybody can use at home to release some of the tightness and pain. Especially we'll be talking about lower back issues and some of the shoulder issues. So just to start our video, I'm gonna let Marty introduce himself a little bit, talk a little bit about his method and what he brings to it and like what we're gonna be talking about.
Thank you, Anastasia. I've been a practicing massage therapist for 21 years. My practice focuses on orthopedic conditions and chronic pain. And one common theme I have found over the past 21 years is that trigger points and myofascial tightness may be contributing to a large amount of the pain experienced by my clients. What I'm going to talk about today is what trigger points actually are, what myofascial release is and is not, and show you some practical tools that you could instantly integrate into your Pilates practice with your students that have chronic pain. There's this big idea in the world of medicine that muscle doesn't have specific pathologies, and that's wrong. Muscle, or myo, has been the orphan of medicine going on 100 years. Muscle has long been misunderstood as causes of pain. If something's tight, that can hurt. If something's weak, it could also hurt. Muscle has 4 complaints. The first complaint is if it is adaptively shortened. So if your pec has been shortened all day from working at a computer, that can cause pain. And at the same time, your rhomboids and middle trapezius on the back of your shoulder blade are stretched out and weakened. That can also cause pain. A third cause of muscle pain and dysfunction is chemical irritation. For example, if you have a cold or a flu and you're full of viruses and bugs, that could actually hurt your muscles. And the fourth reason muscle can complain is for trigger points, which is a widely misunderstood term. People think they are knots inside your muscles. Trigger points, or TPs, or myofascial trigger points, are the end result of chronic repetitive strain on your muscles, overuse, underuse, misuse. Maybe you fell, maybe you pulled a hamstring muscle, and the units of contraction that provide the contraction in your muscle bellies themselves fire and they stay stuck. One of the things that I'm going to show you today and compare is foam rolling versus specific trigger point therapy using a much smaller tool, such as a tennis ball or a golf ball or a spiky ball.
Can I ask you something just to kind of set something up at the beginning? Like people who haven't dealt with trigger point release or myofascial release, they might be confused with the terminology. Is there a difference? Are we talking about the same thing? Because there are like fascial meridians and there are like trigger points, and sometimes it kind of gets confusing. What exactly are we talking about?
If I had $1 for every different definition of trigger points and myofascial release, I'd be a wealthy man right now. The concept that fascia and muscle are 2 different things isn't true. The classic textbook on soft tissue pain is called Myofascial Pain and Dysfunction, the Trigger Point Manuals, written by 2 MDs last century. Their experience spans about 100 years of treating physical pain in their practices of physical medicine. Myofascial release with the foam roller may or may not be releasing the fascia or the stuck tissue, but it is hydrating it, making it more softer, making it pliable, taking out immune system waste products that may be contributing to pain and discomfort. Trigger point therapy, you must use a much smaller tool with much more control in your technique, of which I'll explain soon and demonstrate. Because if you try to just push on those tight, taut bands we call trigger points, it'll never release. We need to put the exact amount of stimulation on that spot in the exact way to coax it open.
Sounds good. It explains a lot.
And I want to explain why these tiny taut bands are called trigger points. They're called trigger points because they can, by themselves, without you pushing on them, trigger pain or sensation somewhere else in your body. For example, the shoulder muscle that we're going to work on today is called the infraspinatus. It's on the back of your shoulder blade. It's one of your 4 rotator cuff muscles. When it's dysfunctional, from being stretched, weakened for years of internal rotation, you will develop taut trigger points in the infraspinatus muscle. Its symptoms is this deep, dull ache in the front of the shoulder, not in the taut band in the back of the shoulder, but you feel the pain in the front of the shoulder and down the arm. And if you have a student who goes into a plank position and they go, ow, I feel it in my shoulder and down my arm, you might think, oh, that's a joint problem, but you might want to put them on the ground, put them on the foam roller or the ball and try to locate a taut band, and it just might recreate that pain that they experienced in their plank position.
Okay, so can we, I guess, safely say that pretty much everybody, based on their lifestyle, will have some kind of trigger point, whether it's active or not active in some of the major muscle groups?
Right. The research has fleshed out over 100 years the fact that if you're alive, if you're a human being, or even dogs, they have found trigger points in dog hamstring muscle. We all get it. The analogy is if you have skin, your skin gets dysfunctional and you get acne, you get zits. If you have muscle and you're a human being, you get trigger points. It's a dysfunction of the muscle.
Okay. So we need to treat it.
Exactly. And trigger points have been overlooked, disrespected for decades by clinicians, by scientists, by physical therapists, by massage therapists, by yoga teachers, Pilates instructors, because they're really misunderstood. And to treat them takes a lot of patience and practice. And that's what we're going to do today.
And one more question, I'm not sure if it's going to completely relate to trigger points, but obviously that's dysfunction in the muscle, that's a trigger points are, but can we, by treating trigger points, can we correct some of the postural imbalances that a person might have, or do they relate to that or not really?
Yes and no. Your trigger points can be perpetuating a joint problem by putting tensile strain on the joint. So if you have a shoulder imbalance, these are too tight, those are too weak, you develop trigger points inside your infraspinatus and your pec. That's going to shorten this up even more, and that's going to lengthen and weaken this even more. So it would behoove us to first spend some time on the ground locating these taut bands, finding them, working them out, and then having a good, strong Pilates practice afterwards.
Okay, sounds good. Well, what are, if we want to start working with our trigger points, what commitment does it require? I mean, how often do we have to do it? Is it a daily practice? Is it several times a day? Is it kind of maintenance?
Depending on your schedule, I would say if you want to learn a new skill set for yourself of self-treating your own trigger points and then helping students locate theirs, I'd say 3 times a week, 20 to 30 minutes. Get down on the ground. Don't replace your Pilates time, but add to it. And if you're just too time pressed, take 10 minutes at night before bed or first thing in the morning. Get down on the ground with your therapy ball or your foam roller and go looking for these taut bands.
Okay, and as far as if we want to do it with our Pilates practice, should we do it before a work or maybe some other workout? Is it better to do or release before the workout or afterwards?
Either or, it depends on your time again. In my own private practice of exercise and therapy for myself. For example, this afternoon I'll be home. I'm going to do some trigger point therapy, some foam rolling, myofascial therapy for about 10-15 minutes on my shoulders, and then I'm going to go through a good shoulder opener workout for myself. So I would shorten my 45-minute workout to 30 and spend the first 10-15 on the taut bands on the ground, and then dive into my shoulder opening practice.
So we can say it's almost like a warm-up for the muscles.
It could be a warm-up, yes. Yes, the foam roller done slowly is perfect for a pre-event type exercise. It warms everything up. It doesn't stretch. Stretching has been shown to actually induce injury before workout. So stretching before exercising isn't the best thing, but to do a pre-event massage via the foam roller has been shown to be very effective to enhance the athletic performance of the individual that does the foam rolling or the massage before the workout.
Okay. Well, I guess right now we can move on to some of the practical ways to use this release, and Marty will show us exactly how to work with some of the issues that we can be experiencing in the lower back and the shoulder.
Perfect. A few coaching tips based on the conceptual framework of what these trigger points are comprised of compared to tight fascia. When you treat trigger points, you're addressing a taut band that could be that big or that big, but whose epicenter is only that big. Research has shown that it's only about the size of a pinhead. You can't access that with the foam roller. It's too big of a tool. I can't use my forearm on your shoulder muscle to find the taut band, but I can take my thumb. This is my thumb. Or I can take my fingers. That's my fingers. First you use the foam roller, you warm everything up, and then you go back to the spots that made you go, that was tight, or that was tight and painful. And you work with 3 techniques. With these tools, you do micro movement, you find that taut band's center that hurts the most, and you micro move over that spot. North, south, east, west, little circles, really slow, really tiny. To warm up though, if you use your foam roller, do steam rolling. Roll nice and slow, engage the soft tissue, mild, moderately. This technique, that technique, no pain over a 4 or a 5. It will perpetuate the feedback loop between pain and taut bands and your brain. If your brain gets a strong pain signal, it'll say, keep that taut band in lockdown. So now I'm going to coach Anastasia in self-treating her infraspinatus. And the protocol will be to first foam roll the entire lat, teres major, rear delt, tricep area, and the infraspinatus as well. And that's with the foam roller, the larger tool, steam rolling technique, nice and slow. And when she locates a few of these much more tender taut bands, she's going to place the foam roller with her tool of choice and do the other 2 techniques. Micro moving, nice and slow, or static holding until the pain or tightness starts to go down, and then she'll increase her pressure. Now, why does the shoulder often hurt when people try to raise their arm or they're on the apparatus and they go, that hurts my shoulder? It could be a litany of reasons. It could be joint problems, it could be weakness, it can be tightness, just like we discussed earlier. And in my 21 years of experience, in 3 out of 4 shoulder pain problems or shoulder range of motion problems, the infraspinatus is almost always involved. Why? Because it's stretch weakened, it's lengthened. The origin and insertion are perpetually lengthened, making it weak. As such, it's constantly trying to externally rotate the humerus, but it can't because of modern living. We have rounded shoulders, elevated shoulders, and protracted shoulders. So this gets really weak, as well as the rhomboids and the middle trap. This short 5-minute routine, even less, will show you how to isolate the infraspinatus, as well as give a good general myofascial massage to the entire shoulder area here, that often, but not always, will be involved in ow, this hurts, or ow, that hurts.
So I guess it's also going to be kind of a good preventative measure for anybody sitting behind the computer, driving.
Yes.
You can,
Yes.
if you have like the slouch, shoulders forward, or tend to keep that tension up in the shoulders.
Exactly.
Up here.
Exactly. If you, with your students, promote opening up the thorax, not contracting the abs, but doing your great Pilates core training and loosening up the pecs and the subscapularis and strengthening rhomboids, lower trap, and loosening up lat and pec, you will create this. And that will hopefully create less pain in your students. So how to find your own infraspinatus or that of a student is you take your right hand and feel for the spine of the scapula.
I guess maybe it's best to turn around.
Best turn around, great. So here's the spine of the scapula, the long bone that runs along the back of the trapezius muscle, right? And right below that is your infraspinatus. How do you know if that's your infraspinatus? It does external rotation, so take your palm down here and turn out. Can you feel it contract in there?
Mm-hmm.
Great, so she's on her infraspinatus. Then she takes her, she'll turn back around, lie sideways on her foam roller, up by the armpit, and just slowly, via moving her hips, go up and down. Actually, go.
Like this.
Yeah. So even that's as fast as you want to go. Think of a steamroller going down the street, laying new pavement. It's really, really, really slow. How will we find these tiny taut bands that are that big if we're going too fast? This is just a good general warm-up of the lat, the teres major area, rear deltoid, triceps. Now from here, Anastasia, roll backwards now. And now do the same thing. So stay here in this plane and go up again. Did you find a spot?
Yeah.
Okay. So bingo. She found a taut band that causes pain. It might be a trigger point. So then I'm going to ask her to remove the foam roller, support her head with that, and take her tool of choice.
So basically there's different balls of about tennis ball size or a little smaller. Some of them are a little bit harder, some of them are a little bit softer, I guess.
Right.
I guess it will depend on your pain level, which tool you would like to use first.
Exactly. The pain level is exquisitely important. Pain over a 4 or 5 on a scale of 1 to 10 in anybody who's experienced chronic discomfort and pain will perpetuate the feedback loop between pain spot and the brain. You can't find it and grind it. You can't, well, I gave birth to 2 children. I have a high threshold of pain. Your nervous system doesn't care about that. What it cares about is you using the foam roller to find these tiny taut bands that cause pain, and then going in with a smaller tool and doing micro movement on them and static holding, inducing discomfort or pain levels of 3 or 4, even 5, breathing through it, and as the pain dissipates, increasing your pressure. How long shall you stay on one spot? It depends. 20 seconds, 60 seconds, and then find another spot nearby, which won't be difficult.
Okay, so where do we put this guy first?
So you find that spine of the scapula, that bone right there, right?
So, yeah.
And you take the ball right below the bone.
So I'm going to turn around, so this is kind of on me. If I move my scapula, you'll see where it's kind of located over there.
Here's her shoulder blade, right below the bony ridge is a great spot to put the ball. And you're basically almost sideline. And your arm is out to the side. And again, just now start to move your body either up, down, left, right, really even slower, a lot slower. You could either move your body just like you were Anastasia, or take your arm and extend it out and back, out and back. And are you near that spot where you had the foam roller and it hurt?
Yeah, like right now I am.
What does it feel like?
Feels like get tension that goes all the way from the spot all the way kind of around the shoulder blade. But it's kind of a nice kind of pain. It's not like I can't hold it anymore. I'm about to scream.
On that spot, on that exact spot where you feel it's right there and it's also extending to the surrounding area, you have found a good trigger point. Now use the two techniques of just static holding on that spot, pain levels of 3 or 4, or discomfort levels, because pain for some is just discomfort for others. And take a few deep breaths. And after that time, if the sensation goes down, lean into it more. If the sensation doesn't go down, don't lean into it more. Good. As you can see, she's trying to fine-tune that spot. If you're off of that spot, that's that big, you will not be able to deactivate the trigger point. Deactivation means taking those lockdown sarcomeres, those contraction units of actin and myosin that get stuck. You take your tool here and coax it open. Bring in circulation. Immune system waste products leave, go back into circulation, pain goes down. What are you feeling now?
It's very light. I don't feel the pain anymore.
Okay, so micro move somewhere else. That means just going somewhere else by moving your body a wee bit, but you're still on the infraspinatus muscle. I've met one person in 21 years who didn't have trigger points in their shoulder girdle. One person.
Lucky person.
Exactly. Have you found another spot? Or
yeah, a little lower, yeah.
A little lower. You may ask now, well, how do I know she's on the infraspinatus? Do external rotation of your hand and arm into the floor. Can you feel a pop underneath the ball? Can you feel it move? Great, so she's still on her infraspinatus. So those are the 3 techniques basically. You start with the foam roller. You do a general warm-up of the area that you want to treat, and then the spots that you found to be a bit tender or painful or firmer, those could be the trigger points. Then you take your smaller tools of choice and go in and do the static holding technique or micro movement technique for 10 seconds to 2 minutes. Go somewhere else, find another spot, come back. And when you get done treating the infraspinatus, which is an external rotator, you'll want to stretch it by doing an internal rotation stretch. Exactly, thumb down. And as part of a total treatment method of a shoulder issue, you do the general foam rolling and the specific micro movement static holding techniques to address and deactivate the trigger points. Then you do a good solid stretch, and then you strengthen the shoulder girdle, stretch it out, and then total body conditioning.
Like, is there a certain number of trigger points that a certain muscle can have, or
Lots.
So like we can keep finding different spots, and if we released one, there can be others that are still there.
Yes, there are primary trigger points and secondary, meaning you can do overload by carrying a heavy suitcase and activate a trigger point in your trapezius muscle that refers pain into your shoulder blade. And then your rhomboids, which are in that referral zone, will get secondary trigger points. So it can be frustrating and overwhelming to go, where do I start? I would suggest getting a reference such as the Trigger Point Therapy Workbook by Claire Davies, or just go online and Google trigger point self-applied therapy, and there will be a litany of hits of different websites, different resources, whether you want to learn online or order a book at Amazon. All you got to do is start looking for these trigger points based on where you have pain. And often the site of pain, the front of the shoulder and the arm, doing your Pilates and planks, may be caused by the infraspinatus muscle back here. Right now, I just rolled over a taut band and she's going, yeah, that kind of hurts. I know that. How did I? Everybody's body has the same mechanical joints and the same stressors. Everybody's got it in infraspinatus.
Okay. Sounds good. Yeah.
Shall we shift to the low back muscle
let's
choice?
do that.
We're going to talk about the sister nemesis pain muscle for the pelvic girdle compared to the shoulder girdle. In the shoulder girdle, I have found that shoulder pain doesn't always has a primary pain complaint and dysfunction from the infraspinatus muscle, but it is often involved. And it's the same for low back pain, enigmatic low back pain. Most PT books and even massage therapy books on protocols for back pain and causes will give you a litany of structural reasons: tightness, arthritis, facet joint dysfunction, disease states of the nervous system, but seldom will they talk about myofascial dysfunction, aka trigger points. The dysfunctional gluteus medius muscle, which is, if you turn sideways, starts at her iliac crest and inserts onto her greater trochanter. It's like a slice of pizza or an ice cream cone. Thank you. When dysfunctional, it will create trigger points. Why? It's adaptively shortened. It's weak. Cumulative stress. One knee is internally rotated compared to the other one. One foot is flat. A shoulder's higher. Will all cause long-term slow weakness in the muscle belly, and then the muscle belly finally goes, I'm done, and it creates a taut band. So the way to treat gluteus medius is the same as infraspinatus. You start lying on the muscle just below the iliac crest.
You want to go sideways?
Sideways.
Sideways.
Right, so perfect. Some people will put this foot in front. Some people will lay it on top. Some people will lean all the way down. Some people will be up on the elbow. Yes, engage your core muscles to stabilize, but the goal is to pay attention to what's going on underneath the foam roller. It's the same when you watch your students on the reformer. You're watching them to see where their alignment issues are, identifying weak muscles and then strengthening them. It's the same here. It's not about doing it, it's about feeling it. What's going on underneath the foam roller in order to then get the smaller tool on that trigger point that's that big. So do the same thing. Just go up and down along the medius muscle between the top of the iliac crest and your trochanter. And that's as fast as you should be going.
We're not on that gym like this, right?
Right, that's the worst thing to do. Now, since your medius doesn't only go north to south, it also extends to the rear of the hip and the anterior hip. She will then go in a backwards plane and do the same thing. And now roll back to neutral and go anterior and do the same thing. If you look at the image that Anastasia has uploaded, you'll see that the gluteus medius do look like a slice of pizza. I'm very food oriented and driven. So just working the center of the slice is not enough. You have to go backwards to the right side of the slice and then forwards to the left side of the slice to get the entire muscle belly. The trigger points associated with gluteus medius are traditionally up by the iliac crest. In your work now, have you found any spots that make your eyes open or not really?
Just a little bit, but not as
Not
much
like
as
your
with the shoulder, no.
Okay, so
Just a little bit of.
let's try your pink ball. Take out the roller and place the ball in the middle of your medius at the top of the iliac crest.
Let me turn around so that I can see it. So that's going to be about.
So here's the trochanter bone. Here's the top of the medius. There's the posterior aspect of the medius. And here's the anterior aspect of the medius. So a good place to start if this is new to you is you find the top of the crest and go right underneath it. Some people prop themselves up on the elbow, some go down on top of the foam roller for their support. Again, some people have foot positioning to optimize the weight bearing or to lessen it. What you'll find with people when they work for the first time is they use balls that are too big or too hard and they go, ow, ow, that hurts. They need to be raised up or the balls softer and smaller. So if all your student has is one ball, for example, that pink ball, which is semi-firm and the size of a tennis ball, if it's too painful, you take a towel and you roll it up to raise up the height of the individual, to soften the ball's pressure. Are you feeling anything with this?
The top one, no.
Okay, so just move the ball around.
But
Just a wee
a
bit.
little bit lower, yes.
Mhm.
So that's kind of my spot right here.
All right, so she says that's her spot. And if 10 people say that's my spot, they may be experiencing 10 different things. Get qualification. What do you mean? Is it referring pain somewhere else? Is it dull achy? Is it just tight without pain? All are good reasons to work there.
Well, for me, I just feel it going down my leg a little bit.
Okay, so that's a positive trigger point referral sensation. Now, ease up out of that spot, raise yourself up a wee bit. Does that sensation stay or does it go away?
It goes away.
So now I will test Anastasia's skill set. Find that same spot. It could take years for the skill set to be developed.
No, it's right here.
And you feel it again?
Uh-huh.
Doing the same thing, down the hip a little bit?
Yeah.
Right, so she's now becoming an expert in palpating and treating trigger points. You have to use the right size tool with the right amount of pressure and the right technique. Not fast, but very slow, deliberate. The intention is to take the sarcomeres, the actin and myosin fibers that have been in lockdown for weeks, months, or years, and coax them open with deep breathing and specific direct pressure. And how long should she work on that one spot? Until the sensation dissipates completely. That could take 20 seconds or 2 minutes, and if it doesn't, and it seems to be getting worse, you fired up the feedback loop between the taut bands and the nervous system and the brain. Go somewhere else and come back later.
So now the next step is to stretch it, right?
Is to stretch it. And the best way to stretch medius is probably to stretch. So it's an abductor. It takes your hip away from the midline. So how will you stretch? How will you put your left hip into adduction? Yeah, sort of. Yeah.
Well, to me, it's not going to get enough, yeah.
One way to do it is to put you up on this, lying on your right side. That's your left side.
Put my right. Yeah. Let me turn around.
Yes.
Maybe to the back to the camera.
Perfect. So, and now take your left leg across, out straight. Actually, you should be on your back with your sacrum.
Okay.
Sorry. We're getting our logistics. And do we have a strap here?
We do it for, yeah, so we'll
For
just
our purposes here, in order to take an abductor that's been harboring these trigger points for years, or tight fascia for years, and you just open it up and loosen things up, you have to then adduct the hip to tell the nervous system, oh, we remember adduction, it's very good. So if she was holding a strap, she would just go and take that hip. And there's neutral, and now she's going into adduction because of the height of the hip is off the ground. Can you feel this somewhere in here?
Yeah, just a little bit, yeah.
Just a wee bit. Now
Yeah.
from here,
I'll have to, probably.
you could do that. You could also tighten up your thigh muscle and do internal rotation of your femur, and you'll get the posterior fibers. Now do external rotation of your femur, and you'll get more of the internal fibers of Gluteus Medius. Another way to stretch this is off the side of the reformer or a Cadillac.
Feels better.
One more thing, ice versus heat. Trigger points are stuck soft tissue, tight fascia as well. It's tight, you want to loosen it, you want to hydrate it, you want to warm it up. Moist heat and stretching is almost as effective as the tools and the foam roller. Best to use moist heat followed by a good stretch at the end of the day on the problematic area.
Yeah, so for moist heat, we can just use like a washcloth, put it in the microwave, wet washcloth, microwave it for a little bit, or just keep it in hot water for a little bit of time to kind of get that.
One of the best things to use is to go get one of those buckwheat neck warmers or a yoga eye pillow thing which has sand in it or rice. Or if you want to be frugal about it, go to the store, get some white rice, go home in a sock, take the rice in the sock, throw it in your microwave on medium for a few minutes, and then take that moist washcloth around that, throw it on your hip, throw it on your shoulder, throw it on your neck, and then stretch.
Okay, sounds good. Well, thank you so much, Marty, for these tips, for this practical advice. And if you would like to hear more from Marty, or maybe ask him to do a workshop in your area, things like that, just go ahead and leave a comment below and we'll get in touch with you. And don't forget to visit Marty's website. The link will be provided underneath this video. And thank you for watching, and I hope you learned a lot. Bye.
Bye.